Today I want to talk about a topic that too often gets tangled up in misinformation and confusion. That's, are psychiatric medications addictive? Well, the short answer is no, they absolutely are not. Though, I guess I should say there are some notable exceptions to that, which I'll get into today. But before we get further into that, I think it's really important to distinguish what is dependence and what is addiction, because I think that's where most of the confusion and misinformation comes in. First off, let's discuss what dependence is. It's basically when your body gets used to a medication after a long period of time or a certain dosage, and if you were to suddenly stop it or reduce the dose drastically, your body or your mind notices. So I previously did a video talking about SSRI discontinuation syndrome. So definitely check that out if you're interested in that, and I think it's a good example of dependence. But that does not mean you're addicted to SSRIs. I've never seen a single patient in my years of experience who's been addicted to an SSRI. Doesn't happen. I mean, let's be honest, when's the last time you heard of someone selling Zoloft on the street or heard about an illegal ring of Prozac sellers out there? Addiction, on the other hand, is very different. Broadly speaking, addiction is the continued and escalating use of a substance for its effects, and doing that despite it causing issues and also struggling to stop or cut back. We often see this cycle in alcohol abuse, illicit drug use, or even certain behavioral addictions like gambling, among many others. And yes, addiction can also involve dependence. So if you've been using alcohol at high amounts for long periods of time, or certain drugs like opiates, and you suddenly stop those, you can sure bet that your body and your mind will notice, sometimes to life-threatening effects. So why is it that psychiatric medications, for the most part, don't have an addictive potential? Well, it's for a few reasons. One, they don't have an immediate effect on how you feel. Like, you don't take a Prozac and all of a sudden an hour later feel great and happy, despite what the Prozac commercials may show. So there's no immediate effect, and they don't cause euphoria. They don't cause you to be much happier than you otherwise would, or feel much better than you otherwise would. Certainly they can make you feel better and happier over long periods of time if you're depressed or very anxious, but not more so than the average person. The idea is they get you back to your baseline so you can actually start functioning in life, working on therapy, lifestyle changes, and other things. And other factors are not reinforcing. So like alcohol, drugs, certain behaviors can be very reinforcing. They work on your dopamine system to give you this dopamine hit and tell your brain, hey, I like this, let's seek out more of it. So mood stabilizers, antidepressants, anti-anxiety medications, for the most part, do not do that. And yet, despite this distinction, I think much of the public out there is very confused as to what is dependence, what is addiction, what do they both mean? Because frequently you have patients describe themselves as addicted to their Zoloft because if they miss a dose, they'll feel it. So I do educate them about that to help them, one, reduce some shame if they do have that around it, and reframe their concept around their medication, because they're certainly not addicted to it. They're not using higher and higher doses of their Zoloft. They're not taking out a second mortgage on their house to get more SSRIs. Like, that just, it doesn't happen. And I think calling that addiction creates a lot of added stigma and just misinformation about those types of medications. And that's very, very unhelpful. Do I get it? We all say we're addicted to things even if we're not addicted to them. Whether that be a TV show. For me, these sodas, I mean, it's low sugar, has probiotics. I just can't stop drinking them. Maybe I am addicted to them. So now that we've settled psychiatric medications are not addictive, I did mention that there are some exceptions to that. There are two main classes that fall into that category. Those are benzodiazepines and stimulants. So let's start with that infamous class that for many years was every psychiatrist's go-to, benzodiazepines. These are things like Xanax, Ativan, Valium, Klonopin, among others. And these are medications that were traditionally prescribed very frequently by psychiatrists for anxiety. And unlike SSRIs, they work very, very quickly. I mean, within an hour of taking it, you can feel your anxiety start to reduce. And that's one of the dangers with them, is they can really, really be effective at melting away your anxiety. And for some people, they can also come with a euphoric feeling. So there's some of this pleasant feeling, especially as the medication is kicking in. So some of the issues that come up with that is that, of course, our brains are trained or primed to seek out that which gives us immediate relief. So over time, our brains can grow more apt, more prone to craving a benzodiazepine if that's what we've learned always reduces our anxiety. So anxiety comes up and we crave and desire a benzodiazepine to bring it back down, understandably so. Like I mentioned, also for some people it comes with this euphoric effect, though not always. And this can become reinforcing for people. What can happen for people too is they can start craving, wanting higher doses to achieve the same effect over time. And in some cases, if people have been taking this type of medication for many years at a high enough dosage, suddenly stopping it or drastically reducing it can even come with symptoms of withdrawal, such as struggle with sleep, increased anxiety, feeling shaky, sweaty, and in very severe cases, even seizures or even potentially death. Okay, so I gave a lot of scary warnings about this class of medications, benzodiazepines. I definitely want people to be aware that the vast majority of people prescribed these medications take them as prescribed, don't go on to develop any form of addiction from it, and it can in some situations help people with their anxiety, sleep, other issues. It's never my preferred go-to because I feel like it doesn't treat the underlying cause of their anxiety, just kind of masks it by reducing the symptoms in the moment. But it is used very frequently, less and less frequently over time because of those issues I mentioned, but it can still be a reasonable choice for some people. So I definitely don't want to alarm anyone who's been on this medication or knows someone who's on it. The second class that comes to mind are stimulants. And I definitely want to be very, 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 very clear on this. The vast majority of people taking stimulants are not addicted to them, not one bit. They're getting huge benefit to life from them for their ADHD symptoms or any other use that they're being prescribed for. But like benzodiazepines, they do come with some risk of addiction for some people. And that's because like benzodiazepines, they do have an immediate effect on your subjective reality, right? They change how you feel in the moment. And I think that's the kind of underlying thing of any medication with addictive potential is it changes how you feel and experience things. And it can also be, for some people, reinforcing. So kind of create this itch of maybe wanting to take some more to get the same effect. I won't get too much into it because I do want to make a separate video in the near future about stimulants in general and talk about this part of it some more. But at least to say benzodiazepines and stimulants both carry some addictive potential, and I think it's at least worthwhile for every psychiatrist to discuss this with their patient. Give them the warning signs of if you're finding benefit from this medication, but perhaps finding yourself using more and more in ways that are not prescribed, maybe having some secrecy around it, some concerns around it, definitely bring that up because it's worthwhile talking about. Like benzos, you can get some dependence from stimulants. So basically, if you've been on a high dose for a long period of time, then you stop it, you might feel a lot more fatigue, increased appetite, and some changes to your focus, concentration, even anxiety or mood symptoms as well. Though, unlike benzodiazepines, it never gets to a point where it's actually life-threatening or anything like that. So with all of that being said, why is there so much misconception about medications for your mental health and addiction? Well, for one, I think there's just a lot of mental health stigma. So anything related to mental health, especially medications, is just going to come with a lot of misinformation out there and false narratives being spread. I think that's just the nature of it. There's a lot of that misconception around dependence and addiction as well. People not being very clear about what the difference between those two is and the implications of that. The issue that comes up is I think for too many decades, 70s, 80s, 90s, even early 2000s, benzodiazepines were a large staple of psychiatric prescriptions. And I think that there were too many cases, too many situations where well-intentioned psychiatrists were only using benzodiazepines to treat people's symptoms without offering solutions to treat the underlying causes of their anxiety, of giving them skills or even medications to reduce their baseline level of anxiety, teach them how to work through different stressors. And that did cause some issues with some parts of the population and some people in psychiatric treatment. And I think some of that residual effect is still lingering there. I know in modern psychiatric training, definitely benzodiazepines are not regarded as first-line treatment for most anxiety, most symptoms. I certainly still prescribe them, but I'm very cautious of how I do that and the instructions I give patients. And also formulating a goal for why are we using this and for how long. Being stuck at the DMV yesterday morning for 2 hours, I sure could have used the benzo. I'll take the risk. That's what we'll do for now. So to wrap up, most psychiatric medications that psychiatrists prescribe to their patients have no addictive potential at all. But there are some classes of medications like benzodiazepines and stimulants that can carry some addiction potential for some patients. Another thing I want to mention is, as psychiatrists, something we should always be doing is getting a gauge of what's our patient's external locus of control before we prescribe any medication that has addictive potential. What that mental health jargon there means is basically how much does someone rely on something outside themselves to settle their internal distress? Is this someone who every time they feel anxious, they reach for food, drugs, alcohol, cigarettes, or something else that's unhealthy for them that they've tried to stop every time they feel discomfort, every time they feel stressed? And if that is a recurrent pattern that we see, then perhaps prescribing one of the medications won't be the first best step for them. Instead, focusing on that pattern of behavior, finding ways of navigating that and mitigating that need for that external locus of control can be the best approach for them. And if they're still having anxiety, ADHD symptoms, perhaps a stimulant, a benzodiazepine, and very, very close monitoring may be helpful. But with extra caution and an open line of communication of, hey, if you notice yourself using this more, depending on it more, using it like this or like that, that's not prescribed, reach out, let's talk about it, let's see what's going on to help you with your goals. At least that's how I approach it, and I found that very effective. All right, so that's it for this week. Thanks so much for watching to the end. I really appreciate everyone out there. Please leave some comments down below. Always appreciate that. Like and subscribe really goes a long way. And cheers, till next week.